Hey there, you're listening to the O&P Check-in, an SPS podcast.
This podcast brings you the latest happenings in the O&P industry. We're unpacking trends and news from this tight-knit orthotic and prosthetic community.
Yeah, and thanks for joining us again. My name is Brendan Erickson, Regional Sales Manager here at SPS.
And I am Jackie Green, Marketing Specialist at SPS.
Welcome back, listeners. If you're new to the O&P Check-in, here's what you can expect. In each episode, we will discuss a hot topic in the industry, provide SPS updates, and cover a news article from the world of O&P. Let's go!
Welcome to episode 7 of the O&P Check-in and SPS Podcast.
How are you today? What's going on in your life?
Q1, Q2, well, you got to keep track of all the different promos and when they come out and stuff, and
Absolutely.
It's really confusing real fast.
Yeah, absolutely. And it's flying by way too fast. I can't believe it's already May.
I know. It's so nuts. I'm not sure if it's recording these episodes or what, but it seems like it cuts up time in a really weird way where you're like, oh, that's right. We're already through another month.
That's right. I bet that's what our listeners really are looking forward to every month too. They're just like, I need to hear another episode. Yep. It's been too long. Get me more. Yep. So let's give them what they want, Jackie.
In today's episode, we're discussing the latest CMS changes to prior authorization with our very own Sam Brouillette, who is SPS's Manager of Clinical Education.
Yeah, it's going to be great. But before we get started, let's take a quick break.
In response to clinicians' requests for an orthosis with more foot plate flexibility, Alyard USA has extended their pediatric AFO line with Kiddie Flow. Kiddie Flow allows for better control of foot positioning and late swing, which aids in the stability during stance. All Alyard USA's Flow models offer increased ROM in the sagittal plane and a smoother transition flow throughout the gait cycle. Visit spsco.com to learn more and shop the Kiddie Flow today. Thanks, Alyard. Well, I guess welcome back then, and we're going to jump into some SPS updates.
Yeah, and heads up, everybody. SPS Clinical Marketing Consultant Liz Hillen and TaylorMade's Clinical Director Simon Dickinson have put together an online CEU course titled Evidence-Based Cervical Clinical Solutions for ALS and Other Neurological Conditions.
Yes, it's a really good CEU course. You guys should go check it out.
Absolutely. What will you learn in this course?
So Liz and Simon go over how to modify and adjust the fabric component of TaylorMade's heads-up collar and differentiate support, strut, configuration, and customize the device based on degree of weakness and daily activity. It's really informative. It's really interesting, even for somebody who has no use of the CEU credits. And you can find that. You can find the link for the CEU course in our show notes. You will earn 1 CEU credit. And we also have 14 other courses that you can check out as well if you are in need of CEU credits. And those are all on the clinical service page on spsco.com.
Awesome.
We're happy to welcome SPS Manager of Clinical Education, Sam Brouillette, to the show. Sam is a certified prosthetist and certified orthotic fitter with over 28 years of experience in the industry. He travels around the country educating fellow professionals about new technology, trends, and policies, and we are really excited to have him on with us today. So welcome, Sam.
Hey, thank you, Jackie. Wow, this is a dream come true.
For us, not you, man. We're honored to be right here next to you.
Nah, this is great. Awesome team here in the marketing department of SPS and Brendan. So I'm honored. Thank you for having me on.
Yeah, no, thanks for joining us. So today we're going to chat about the CMS changes. For our listeners who haven't had the pleasure to meet you yet, could you tell us a little bit about yourself and how you became such a valuable resource for us to talk about these CMS changes?
Yeah, so 30 years in the field of O&P, started off as a technician, worked my way into a certified prosthetist, certified fitter of orthotics, only because we had to do hospital calls. Nothing against that, but prosthetics all the way. That's my passion. Actually, so, policy is something that I kind of always had in practice through the gentleman I worked for, make his arguments on audits or different types of things that the DME Max or Medicare, and he was always up on policy. He had one time he actually sat down with a lawyer and read through the Social Security Act that actually sets up all this stuff. So just seeing that part, I love history. So going forward we can stay informed, but I always wanted to going back, where did all this come from? Where did it start at? So it's kind of like putting together a history puzzle to me. So yeah.
So let's take a look back to 2020. As we know, CMS implemented a requirement for prior authorization of 6 lower limb prosthetic codes, and then PDAC added requirements for articulating digits and prosthetic hands in 2021. How big of an impact has prior authorization and then the PDAC requirements, how much has it affected our industry so far?
Yeah, I think it's affected our industry in talking with our customers. I think it's affected our industry in a positive way, at least within the prosthetic realm. Prior authorization is you're putting the same paperwork documentation that you would normally have submitted afterwards, after you paid all the money out for the componentry or technology and fit it to the patient, delivered it. Now you're getting an affirmed if it positive, right? So if it's positive, that's a good thing, right? It's an affirmed prior authorization before you actually invest in that. So I've heard from a lot of our customers where they really like this aspect of prior authorization. Now that's in the prosthetic realm. The
so you're saying
realm is just launching.
You're saying it's lowering the risk.
Well, it absolutely does lower the risk, and even from a Medicare perspective, they're doing this to lower the after issues where you have to go through appeals and ALJs and all that stuff. So I think it's definitely been positive and lowered the risk to our customers. And they know when they go into it that this is covered and they have the correct documentation to support it. Now, talking about the digits, yeah, thank you, Brendan. You're super smart. You actually pay attention when I talk. I love that.
I also listen to our fearless producer who helps me with these questions.
That's true. So on the articulating digits and the articulating hand, prosthetic hand codes, that's something that was implemented back in 2021. And it's actually PDAC. So it comes down from the government, from CMS. And it's a joint announcement by the DME Max, that's the contractors, and PDAC to say, hey, we need some verification that these products meet these codes. And that's what it is. So not to confuse prior authorization with PDAC verification requirements. You may see them both together or come out after each other, but you don't necessarily will see them always together, right? Just because it's prior authorization requirement doesn't necessarily mean it's a PDAC requirement or vice versa. So
makes sense. Thanks, bud.
So can you tell us a little bit about the CMS recent HCPCS code addition to the prior authorization policy? And tell us, I don't know if you have the actual code numbers in front of you and can list those out for us too.
Well, absolutely, Jackie. I've got them memorized.
Oh, man.
I do. Watch this. 2 LSO codes. No, I'm totally joking. I'm reading it. There's 2 LSO codes, lumbar sacral orthosis, L0648, L0650, and then there's 3 knee orthosis codes, 1832, 1833, and 1851. So these were brought up and announced actually last year that these would be going on to prior authorization starting this year. And with that said, the prior authorization process is exactly the same. You're getting your documentation, your doctor, your medical records, your medical necessity language together prior to delivering the orthosis to the patient, prior to payment. It's the same paperwork. You submit it. You're looking for that positive, that affirmed prior authorization. Then if you don't receive a positive, say you see it, you get non-affirmed, you can resubmit that as many times as you can submit that 10,000 times without any penalty, and then look at what they're saying is denied, and then fix those issues. A lot of times it's just a documentation wording, or maybe a physician didn't sign correctly, or a date's incorrect. Sometimes they're very simple things. So with that said, it's exactly the same. For the exception, the day before the first 4 states launching the prior authorization for orthosis, Medicare actually came out and said, so first of all, prior authorizations can be taken back at any time. The government can just stop them whenever they feel necessary. That's for a group of codes, a singular code, whatever. And it's actually pursuant to this 42 CFR 414.234F, where it states that CMS can suspend the DME prosthetic orthotic supplies prior authorization requirements at any time, in part or in whole. And then they state that due to the need for certain patients to receive an orthosis item that may otherwise be subject to prior authorization, when the 2-day expedient review would delay care and risk the health or life of beneficiary, we are suspending prior authorization requirements for HCPCS codes 0648, 0650, 1832, 1833, and 1851, furnished under these circumstances. Now, with that said, they also say if you want to go ahead and deliver and bill without prior authorization, they're going to allow you to do that. But most of our customers will be under 100% prepayment audit at that time. You will get a prepayment audit. And then there are some other small things, another paragraph in there about suppliers that have competitive bidding program. They're on the competitive bidding program. And there's just some different circumstances of what they will go through. So.
Wow. So it sounds like it's pretty detailed and in depth, and there's positives, I think, on both sides of this, right? It's going to help deter, people receiving these if they don't need them. And it's also going to mitigate risk for the people providing them, knowing that they are, a step closer to getting successfully paid. So how are the orthotic additions that happened this year in 2022, I guess, if there is any difference, is there a difference between them and the prosthetic ones that were put in place in 2020?
None at all. None at all. It's the same prior authorization, whether it's for orthoses or prosthetics, the prior wheelchairs, power wheelchairs, glucose monitors, whatever is under DME POS. If they state there's going to be a prior authorization, they're going to give a 60-day notice. It's in the law. They'll give a notice, and it's the same process. They are looking at your medical necessity language of your documentation to show the need for that service, for that device, for that patient.
What can our listeners do to prep for these changes?
Oh, this is what I wish I had Ellen 10 years ago and could have learned from your producer on surveys. I actually started about in 2012 when we were in the middle of rack audits on microprocessor products, and looking at this, and I would ask clinicians, have you read the local coverage determination for lower limb prostheses? And back then I would get maybe a 20% response. They actually have read it. And the number one of the big reasons for the rack audit starting up on that was an OIG report that came out in 2011 that in one of the things they stated a lack of documentation to the LCD. So with that question, Jackie, the answer is go to your DME MAC website, join their mailing list, their electronic mailing list. You'll get notifications of changes, policies. Matter of fact, I just got one this afternoon from CGS that's talking about education opportunities and webinars explaining prior authorization, lower extremity prosthesis documentation. So there's a lot of resources. So one, I would say electronic mailing lists, whether that's CGS or Noridian, that's the 2 DME MACs. Go to cms.gov, get familiar with the website. Read the LCDs and policy articles that are out there, lower extremity prosthetics, lower limb orthosis, spinal orthosis, those type things. Make sure you understand, make sure you're reading the latest version. And you find those on the website, on their websites, either CGS Noridian, or CMS's website directly, go to this really cool thing called spsco.com/resources/learning center and scroll down and get the links for all this stuff. It's all there. It's all out there. I'm not an academia professor. Just read the policies are not hard to read a lot of times.
Okay.
A lot of times they're double spaced, double margined, 2 pages, maybe 8. So.
Well, that's awesome, Sam. And I know there's other advocacy groups out there, trying to make a legislative change and things like that. Would state associations within O&P or our national academy or AOPA have insights into this too?
Absolutely. I would also apologize for leaving them out. Subscribe to AOPA's newsletters. Matter of fact, it was AOPA and some of the other government things within O&P that got that concern about lower extremity orthoses, the 5 codes we just mentioned, we talked about, that these could have a dire need to be fit immediately, right? And so AOPA and some others had a discussion with CMS, and that's where this new policy where they're basically saying, hey, you don't have to get prior authorization under certain circumstances. So right. Yeah, subscribe to AOPA, like Jackie's social media posts or whatever. Is it like or subscribe? I don't know.
Yeah. Depends on the platform.
You got to mash that thumbs up or whatever the kids call it these days.
Yeah.
So, okay, Sam, looking into your crystal ball, tell us this. Do you think prior authorization is here to stay? And that could be for a positive or negative. I don't even know. This is your own crystal ball. You tell me what you see and what L codes are next coming down for prior authorization.
So, yes, prior authorization started back in as early as 2015. That was looking at effect. Now, the first 2 codes were actually mobile electronic wheelchairs, power mobility devices. So some of this stuff doesn't pertain to maybe our O&P clinics, but it is under that bigger umbrella of DME POS. They can look at this, the 6 codes in prosthetics, and say, hey, everybody's, we're getting 100% affirms now. Everybody's doing the right things, and they can pull it back. Or they can come out with prior authorization on something else. So I think prior authorization is here to stay in some realm. Might not be exactly what we're seeing today. We might have additions. We might have some things taken back. But I think it's what our field really needed in talking with our customers. I'd much rather have a prior authorization process on a expensive orthotic or prosthetic device versus a prepayment audit or a post-payment audit.
Oh, I totally agree with you, Sam. That's a great point.
So, crystal ball, the next codes to come down the pipeline, there is something called a master list. So it has to be put on a Federal Register master list to be considered for either prior authorization list or face-to-face encounter and SWO. It's standard written order prior to delivery. That's 2 lists, right? Master list feeds into 2 lists. It's got to be on the master list first to go into the other 2, the prior authorization or the face-to-face encounter list. There's over 100 codes pertain directly to O&P on that list.
Wow.
So can you recite them all?
No, but I think a lot was covered in that when they did prior authorization on the 6 lower extremity codes, then enacted PDAC, we saw a lot of scrubbing going on in that, there's a lot of products that didn't meet code verification, thus would not meet prior authorization either. Our field has learned how to document correctly to get the affirmed prior authorizations. So there's been a lot of that going on. If I was to guess, a lot of people say it's the most costly devices, right? So that's the 6 codes. Or it's the most utilized or possible, the most that might have a fraud or inaccurate documentation associated to it. Well, one of those codes is L5858. And when you guess what that is?
Microprocessor swing and stance.
No, that's
5856. Man, I'm
that's
old.
Right. You're 5856. 5857 microprocessor controlled swing. 5858 microprocessor controlled stance. There is none on the list. So I don't think there was any high billing on that. There are no products
Gotcha.
that I know of that fall in that code. So with that said, take a look at what we're doing, read the policies. There's narratives. So if I had to guess based on the lower limb prosthesis policy article, which is the second half of the book to the LCD, they listed narratives prior to all this, and they were long narratives of description, which we didn't have before. And ankles have a long narrative now. So maybe some of the ankle codes, the 5886 multi-axial, maybe. So we'll see.
Before we get into the hot seat questions, is there anything else that you would like to add?
No, I actually just restate. And I tell people this all the time. It's not hard reading. Now, going backwards and trying to figure out Federal Register, Social Security Act, okay, that's it. You need a paralegal degree for that. But read the LCDs, the related policy articles, and if you don't know what those are, it's local coverage determination, lower limb prostheses, lower limb prostheses policy article, standard documentation of all things billed Medicare. There's 3 policies. There's 3 little things. Honestly, I learned this in high school. It's double spaced, double margined. It's not that many pages to read. So I would say do that. Subscribe to our newsletters. Go on our resource page. We have all those links listed. So that's Learning Center, Resources, Learning Center, scroll down, policies. And then, just be in touch with your DME Max and look at their websites. That's all I do.
Right. All right. So now we're going to move into the part of the interview where we turn up the heat and we ask you some really tough questions after those we just gave you. Sam, what is your favorite childhood TV show?
Ooh, childhood TV show. It was The Munsters.
Okay.
It was in black and white with all kinds of contrasting lighting, and it was fun and entertaining. And
That's
totally
awesome.
Totally not real.
Yeah. Escape reality, man. Okay, here's another one for you. And you have to, if you answer yes, you got to tell us why and where. Have you ever worn socks with your sandals?
No.
Easy.
Are you sure?
Okay, yes. When I joined a gym years ago, and after you take the shower, you throw your socks and your little flippy flop sandals on, maybe, but no.
Double dipping. Good or bad?
If I'm the only one eating out of the bowl, it doesn't matter.
Yep.
All right. So how many cups of coffee are you drinking per day?
0.
Well, caramel iced macchiato with, something that counts.
All right. That counts? Okay.
That counts.
Well, then it's 4 shots of espresso with 14 ounces of steamed milk.
There you go.
Okay.
Coffee gives me the jitters.
What is your middle name?
Patrick.
Okay. I knew that one. My brother's name is Patrick, so I've always remembered that, Sam.
Yeah, according to my mother, I was named after JFK's son who had passed away 3 months prior to my birth.
Wow.
Oh.
Yeah, but I told you I like history, so yeah.
Hey, 100% of the time, you're either right or you're wrong, Sam. Thank you so much for your time.
Yes, thank you for joining us today.
Well, thank you all for having me. It's been a lot of fun.
Okay, Brennan, it was great having Sam on. He is always fun to chat with, and he's just a plethora of information and knowledge. And gosh, I feel like every time he opens his mouth, I just learn so much from him.
Oh, yeah, absolutely. Sam's the best. And I mean, he's probably trained, I don't know how many CPOs and COs and even technicians across the nation. But even for, somebody that never went through schooling like myself, when I do a ride along with Sam, I just sit in the car and I basically soak it in. And that goes for Liz Hillen as well. She could have, given us a really, really good overview here. But what I really took away was the positivity, It's almost like you hear the word prior authorization and it sounds so daunting, but it really is a relief to some people, like he was saying. where they can, I guess, have that comfort and that confidence that what they do on a daily basis is now going to be reviewed prior to providing the appliance or device. And then with that, they can have the confidence that they'll likely get paid versus kind of taking a gamble on whether they will or not. So yeah, it seems very positive for me. And I like that outlook. I'm a glass half full guy, and I know you are too, Jackie. But I think our industry really needs something like this to kind of, let them do what they feel is clinically appropriate.
Yeah. And shout out to our current SPS trend survey about prior authorization and PDAC changes.
Yeah, that was awesome.
We're trying to gather more information on this and your thoughts and how you guys feel about it. So we would like to hear from you. So if you're really enjoying this podcast episode and you are interested in learning more or getting more information through the SPS Trend surveys, please look at the link in our show notes and head over to take that survey for us. Well, now let's talk about some exciting things happening in O&P news.
Yeah, I thought this one was really cool. It's all about sustainable solutions in the materials and fabrics that we use in our industry.
Yep. How is hemp being used to make prosthetic limbs? Yeah,
this is pretty awesome. It features Kyle Trevzona. Am I pronouncing that right? I hope I am, Kyle, and I apologize if I am not. But he works over at Human Plant Solutions, and we found an article that talks about how they're using hemp to actually make prosthetic limbs, which is pretty darn awesome.
Yep. It's pretty neat. I know a while ago I saw an article about all the potential use of hemp plants and how it is so much more sustainable to create things out of this. So it was just so neat to be like, wow, just one more thing that you can make from hemp.
Yeah, absolutely. It's like they'd say it's the wonder plant, right? And
yeah.
I mean, what's really cool is there was a link in my mind back to when we were doing all the reading for the SPS scholarships. And there was, a handful of people that recognized this kind of need for material change. And it was mentioned throughout multiple essays where they're saying that in their future, how they're going to affect and change the industry is to go ahead and try and create more sustainable materials. And this falls right in line with it. So, perfect inline thinking with all of our young go-getters out in the field as well.
Yeah, very much so. So shout out to Human Plant Solutions for coming up with an innovative and different way to create prosthetic limbs.
Yeah, and I know it will never completely replace carbon fiber or things like that, and also provide just a new safe way to build these devices that are changing people's lives.
Right. Yep.
So absolutely, where can we find more of this? Or more about this?
You can find more information about this article in our show notes. There will be a link to the Denver channel or Denver Channel 7, ABC. They are the one they have a video interview, and there's also an article. You can check it out there.
All right. That's it for us today. Thank you for listening to the O&P Check-in, an SPS podcast.
If you like what you hear, subscribe to the show on Spotify, Apple Podcasts, Stitcher, or wherever you listen to your podcast. Please rate and review the show to help fellow O&P professionals find us.
Yeah, and we'd also like to hear from you directly. What topics do you want us to cover? Do you have any burning questions? Email us with your thoughts and feedback at spspodcast@spsco.com. See you next time.
Bye.